Welcome to today's podcast on MedSynapse, where I bring you insightful and meaningful conversation with leading experts in medical field. Today, we investigate a critical topic which every athlete and fitness enthusiast must understand, that is sports injury. Hi, I'm your host, Dr. Smarika Bhatt, and today we have an extraordinary guest with us, that is Dr. Kapil Saoji, and he's a very accomplished orthopedic specialist with a dedication to excellence, trained under legendary surgeons like Dr. Pradeep Monot in foot and ankle surgery, and Dr. Gaurav Reddy in robotic joint replacement, one of the pioneer of joint replacement in India, and international acclaimed surgeon as well. His brilliance, excellence, and outstanding surgical skills in exemplary ability to communicate effectively and clearly are the attributes which set him apart. Welcome, Dr. Saoji, welcome to our podcast. We are excited to have you.
Thank you.
So let's start with today's first question of the podcast. What are some of the common sports injury which we encounter during your practices?
So during my 3 years of practice, last 3 years of the practice, I had seen many athletes, Asian game players, Ranji players, and many other cricketers and non-cricketer sports players. In those, I have seen around the knee, there are many problems, many injuries that these athletes coming with. Out of these, major injuries are anterior cruciate ligament, that is ACL ligament injury, and the meniscus injuries. Around the ankle, there are multiple ligaments. In that, the calcaneofibular ligament, that is CFL ligament, ATFL ligament, that is anterior talofibular ligament. These ligament injuries. Other than that, the OCD lesions, that is osteochondral defect, that is a lesion in the cartilage of the ankle, that the talus bone. These injuries are common in the sports players. Along with that, the muscle strain. Muscle strain means overuse of the muscles. Most commonly, you must have heard about the hamstring strain or the calf strain. These are the type of sports injuries. They are occurring in the sports players on their daily training. So how to avoid that or how to treat that will be my subject to talk about. Along with that, many other sorts of injuries like head injuries, shoulder injuries, back injuries are also common in different type of sports. Like in cyclist athletes, the head injury is more common because there is concussion of the head on the floor after the accident of the cycle. So in football players, the foot and ankle injuries are very common. In long jumps, the long jumping players, the ankle injuries and hip injuries are more common. The javelin throw athletes, they have shoulder injuries and elbow ligament injuries are commonly seen. So different ligament injuries and different joint injuries are seen in different types of sports and sports related person.
So as you have touched upon various sports injuries, so there is one common sports called cricket, we know. So what kind of common injuries which we can encounter in cricket specialty?
Most common injuries in the cricket are the muscle strains, which I talked about, the hamstring strain and calf strain. Apart from that, the knee ligament injuries are common, like ACL, that is anterior cruciate ligament injuries, and meniscus, that is medial meniscus and lateral meniscus sprains, strains or tears. These are commonly seen in cricketers. Also, along with that, the ankle injuries are also common in cricketers, like ATFL, that is anterior talofibular ligament sprains, then calcaneofibular ligament sprains, syndesmotic ligament sprains, deltoid ligament sprains. Such ligament sprains are also commonly seen in cricketers.
Okay, so you have addressed and touched upon a few pointers called ACL, TS, meniscal and tears and ankle sprains. So how do you diagnose them and treat them in a pharmacological intervention way?
Initially, whenever there is an injury on the field, generally the sports person first present to the nearby physiotherapist, that team. Then the physiotherapist evaluate the severity of injury and then they refer those players to my clinic, orthopedic clinic. So after reaching my clinic, I generally first thing is to take the history, means how the injury occurs, whether it is because of the fall or whether it is because of the hit. hit by the external objects like ball, bat, such kind of injuries are there, or is it because of the hit to the rock or some hard object which can cause severe injuries? So history taking is most important, or the first step in any sort of injury, because that gives the idea what sort of injury we need to look in the patient. So after history taking comes the examination. So for knee, there are multiple tests are there to recognize or to diagnose the different type of injuries. So for the ligament injuries like anterior cruciate, ACL tear injuries, such injuries can be diagnosed with the anterior cruciate ligament anterior drawer test. It is called anterior drawer test. And the other is Latchman test. Generally, Latchman test is bearable. The pain in the Latchman test is bearable for the player than the anterior drawer test. So generally we do the Latchman test first, and for the anterior cruciate ligament, and second is McMurray's test, which is done for the meniscus tears. So the two major injuries in the ligament and the meniscus can be diagnosed or evaluated using the Latchman test and McMurray's test respectively. In ankle also, for the ligament injury purpose, the ATFL, that is anterior talofibular ligament, or CFL, calcaneofibular ligament tears, that can be diagnosed using same anterior drawer test and the opening. How much opening of the ankle, clinical opening is there, how much subluxation is there clinically after the stress test, that can be evaluated on the clinical examination. After clinical examinations, third part comes is radiological evaluation, that is X-rays and MRIs. First basic investigation is X-rays. If on examination of the knee or ankle, if I found there is significant examination findings, then I generally tell the patient for the standing X-rays, anterior AP X-rays, lateral X-rays. Sometimes few specific views of the X-rays may be needed for the evaluation of the injuries, and the stress X-rays. That means we give the stress to that ligament and see whether there is opening of the joint or not. If the joint is opening on giving the stress on X-rays, that means the ligament is completely torn. So that is the basic radiological evaluation of the joint or the ligament injuries. If I found or suspect there are high suspicion or high chances of the ligament injuries, or if I found there are meniscus injuries or other injuries like cartilage injuries which are not seen on the X-rays, so I advise them for the MRI. MRI is almost confirmatory. It is not 100% confirmatory, but almost confirmatory for the ligament injuries, meniscus injuries and cartilage injuries. So on the basis of MRI, we finally conclude or diagnose, or the final conclusion of all our examination is on the MRI finding.
So as you have specifically mentioned about the various investigation and aspect to it, so as a leading healthcare professional, could you touch upon the various advancement of technologies, medical technologies, which will help you for identification of those?
There are different ways to identify and treat the injuries. First, I will tell about the treatment, and in those treatment part, there are the different technologies we use. So in the treatment for the any sports injuries, we generally our first aim to treat the patient is we recognize the patient's goal. Whether patient wants to return to the sports as early as possible, that is the goal, or the goal is to rejoin the daily activities. Because the two goals, there are two different ways to treat for these two different goals. If the return we need the fast return, then we need to mobilize aggressively. We treat it very aggressively. If patient's demand is to rejoin the daily activities, then the demand is low. If there is low demand in the patient, then the treatment will change accordingly. So that means we do not have to treat the patient or the injuries very aggressively, like in return to sports active athletes. So in the treatment part, first is always the conservative part. On the basis of severity, we generally decide the treatment. If patient's demands are low and the injury severity is very less, in those cases we generally go with the conservative treatment. Conservative treatment means non-surgical treatment where surgery is not required. In this, the first thing is rest. Rest is the most important thing to deal with any injury. Rest can heal the injury. If you don't take the rest, no injury can be healed. Second part of the conservative treatment is immobilization. Immobilization means if there is injury to the knee, we will have to avoid the knee bending and making it straight. So we will apply the plaster or the belt to the knee where the knee will stay in the straight position, it won't bend. So for different sorts of injuries we require different types of belts. So second part is applying immobilization to the joint. Third is the cold treatment, that is ice, application of the ice or any cold packs. The advantage of that cold treatment is it reduces the inflammation, it causes vasoconstriction of the capillaries around the injuries, which reduces the bleeding inside the injury site and reduces the swelling. That way it reduces the swelling. So the cold compression is useful to deal with the inflammation or acute injuries. And the fourth part is elevation. Whenever there is injury to knee or ankle, we have to keep the knee and ankle little bit elevated than our sleeping posture or our heart level, so that the blood accumulated at that site will get drained towards heart as early as possible. Similar is applicable to the elbow or wrist injuries. We have to keep the hand elevated so that the swelling reduces early. Apart from this, second part is medication part in the conservative treatment. So we give some painkillers for the patient to deal with the acute pain or severe pain in the initial period. Then few medicines are there to reduce the swelling. Few medicines are there for the early recovery, like collagen. There are different sorts of collagen available nowadays, type 1 collagen and type 2 collagen. Generally type 1 collagen is given for the ligament or soft tissue injuries like ligament, meniscus, these injuries. And type 2 collagen is given in hard tissues like hard cartilages of the joint, bone injuries, and along with that the calcium and vitamin D supplements are required for the healing of the all types of injuries. So these medications we generally give to the patient in the acute injuries. Then along with that, the other part is physiotherapy. In physiotherapy, whether to do complete immobilization, whether to give little bit of mobilization or give the full mobilization, that depend on the patient's expectation and the pain bearing capacity and the severity of the injury. In most severe cases, we have to immobilize the joint, we have to immobilize the movement completely. When the injuries are mild, we can allow the patient to walk, or we can allow the patient to bend the knees or bend the ankle joints, movement of the ankle joints or the other joints can be allowed. So that way we treat non-conservatively. On the surgical sides, there are many types of surgeries for the different types of injuries. So for ligaments, for meniscus, there are different types of surgeries. Nowadays the keyhole surgery you must have heard about. The arthroscopic keyhole surgeries are available, where we use the specialized telescope or the camera to see inside the joint. Also we have the minute instrumentations which can stitch inside the joint or take the bites or repair, or we take out or excise some part of the meniscus if it is torn. So different sorts of instrumentation and the cameras are available to see inside the knee joint or ankle joint and treat them. We use different kinds of materials to sutures also. There are internal braces or fiber wires are available which are very hard in the strength, which cannot be broken after the after repeated trauma in future also. So we use those kind of internal braces, fiber wires, suture anchors. There are specialized screws, bioabsorbable screws are there, which are not seen on the X-ray and which get incorporated in the bone. So after 1 year, the screws automatically converted into the bone. So there won't be anything after 1 year inside that. So there are different types of materials available for the surgeries as well.
Okay. So that was very interesting that you have told me that suture get dissolved by themselves only, because that is really new for our audience and us as well. And so it's just a follow question regarding it. You have told we'll do the internal suturing and the patient will get healed afterwards, after the year, what will be the recovery period. Yes. So if the patient has not mentioned in their history that they are allergic to particular material, so how do you go about it? How you prevent it? Because there will be chances that they will be allergic to that material and it can get worse and then actually getting recovered.
Yes. Actually, the material used in the knee joint or any orthopedic surgeries, generally they are made in the metals. They are either stainless steel, titanium. These are two most commonly used materials for the sports injuries and general trauma in the orthopedics. And the suture materials which we use are fiber wires or ethylene. Most of these materials are biologically inert. That means no biological tissue gives any reaction to these kind of materials. So generally we do not ask them about the allergies also. Okay. These are biologically inert materials on which it is timely tested on last 20-30 years that there is no allergy seen against those materials. So we need not to ask for the allergies to these materials.
That was really great, insightful insight. And as you have touched upon physiotherapy, so physical therapy plays a significant role in the recovery, as you have mentioned. So what's your perspective of importance of rehabilitation, like how we should go about it?
Rehabilitation is the most crucial part of the recovery or healing of any kind of injuries. So any kind of injuries, whether we treat conservatively, non-surgically or surgically, it needs physiotherapy or physical therapy for sure. The aim of the physical therapy is different in conservative and in operative patients. For the conservative patients, the aim of the physical therapy is to keep the joints as less mobile as possible. Along with that, the static strengthening, the muscle strengthening, but without moving the joint. That is called static strengthening of the muscles. So that is the main aim of the physical therapy in conservative side of physical therapy. In post-operative cases for the rehabilitation, generally the immobilization, that is static exercises, are for the very early period, maybe first 1 week after the surgery. Most of the surgery needs dynamic strengthening, that is muscle strengthening after 1 week of the surgeries. Like for the knee surgeries, the most common strengthening is of the quadriceps muscles, that is the front side of the thigh, the muscles on the front side of the thigh. And the second sort of muscle is on the back side of the thigh, that is hamstring muscles. Along with that, in the ankle injuries, generally the strengthening is done in the calf muscles, the whatever muscles available in the calf area, those get strengthened to reduce or to prevent the further injuries in the ankle joint. So the importance of physical therapy is the most in the any type of sports injuries. So also physical therapy is needed to avoid the sports injuries as well. That means if someone has the sports injury, he is recovered from the injury, but later in the life he should not get injured again. So that part also handled with the physical therapy also. So in that part there are different types of exercises are there, different type of forms are there, which we need to teach the athlete or the sports players to avoid the injuries in the further future life.
So we'll wind up this podcast with one last question, that what are some common misconceptions about sports injury that you would like to clarify for our young orthopedic surgeons or aspiring to be?
Actually, the most common misconception in the sports injuries are sports injuries can be managed without going to the orthopedic surgeons. They are very minute surgeries which can be neglected, which will get healed ultimately in 1 week or 2 weeks on its own. There is no need of supervision of the injuries. That are the most common misconceptions in the sports players or the athletes I have seen. So my thought is, or my advice will be, we should not neglect any sort of injury occurring in the sports, whether it is a smaller severity or higher severity. Many a times the injuries which are looking very minute or giving very less pain, that gets aggravated because of the negligence or because of the repetitive use of the same joint in the future, even after small injuries. That can, so the small injury can lead to bigger injuries. Like if there is any grade 2 tear in the meniscus in the knee, and patient or player keep on playing or running on that knee without any supervision, without any rest or proper nutrition, that type 2 tear can lead to type 3 tear or type 4 tear, which will further require the surgeries, or which can even lead to their stoppage from the sports, or their efficacy in the sports will be reduced in the future because of the small injuries initially. So the players or the athletes who are having sports injuries, they should show to orthopedician or whoever is qualified to see the sports injuries. They should take the opinion what needs to be done to prevent their career damaging or career challenging problems in the latter life.
So your insights today about various meniscal tissue to the various advancement in our orthopedic surgery were really insightful, and it was a pleasure to have a conversation with you on this podcast. And thank you to our viewers for tuning in. And remember, if you are a healthcare professional who is eager to delve deeper into medical topics or to have any questions, do not hesitate to join us on MedSynapse platform. MedSynapse platform is not just a resource, it's a dynamic space where we can connect with our medical peers, participate in meaningful discussions, and contribute to the ongoing healthcare debates. So until next time, stay healthy and take care. Bye-bye.